Citrucel caplets are a type of block-forming laxative used to relieve constipation and promote regular bowel movements. Methylcellulose is the active substance. It's a non-absorbable fiber that helps add bulk to the stool, making it easy to pass. Indications: Citrucel caplets are indicated for the relief of occasional constipation and to restore and maintain regularity in bowel movements. How to use: for adults and children over 12 years old, take 2 caplets with a full glass 8 ounces of water 3 times a day. For children 6 to 12 years old, consult a healthcare professional before use. Contraindications: Citrucel caplets should not be used if you have difficulty swallowing or a history of intestinal blockage. Don't use the caplets if you are allergic to methylcellulose or any other ingredients in the product. Special instructions: take each dose with a full glass of water to prevent choking or gastrointestinal obstruction. Do not crush or chew the caplets, swallow them well. It may take 1 to 3 days for Citrucel caplets to produce the desired laxative effect. Consult a healthcare professional before using Citrucel caplets if you are pregnant, breastfeeding, or have any underlying medical conditions. Side effects: Citrucel caplets are generally well tolerated when used as directed. However, some individuals may experience mild side effects, including bloating, gas, or stomach cramps. If you experience severe or persistent abdominal pain, contact a healthcare professional immediately. Allergic reactions to methylcellulose are rare but may occur. Seek medical attention if you develop signs of an allergic reaction such as rash, itching, or difficulty breathing.